Hi everyone, I'm Dr. Jinsmathew. Welcome to my channel, SciVision. Today I am before you to talk about a common psychiatric condition found in children, that is ADHD. As per the report, 3 to 4% of child population is diagnosed with ADHD, and it is more found among boys in comparison to girls. When I speak about, many parents will be more anxious. Talking about out of 100 children, every 3 or 4 children they might be diagnosed with attention deficit hyperactivity disorder. Does my child has got this issue? Okay, there is no worry about it. Before going to that, let's see what exactly attention deficit hyperactivity disorder is, that is ADHD. Okay, ADHD is predominant symptoms will be deficit in attention span and hyperactivity. In simple terms, this is what ADHD is. Okay, and in some most of the times, there will be attention deficit and hyperactivity, and there is overlapping of symptoms. And in most of the cases, in most of the children, you will find some children having more attention deficit side, less in hyperactivity side. The other way, there can be higher in a level of hyperactivity level and less side in attention deficit side. Okay, well, but there can always be an overlapping. So commonly it is named as ADHD, and at times there can be attention deficit disorder separately diagnosed or hyperactivity disorder. Let's talk more about the symptom side. Okay, in children diagnosed with ADHD, they will have a lesser span of attention. They will not be able to focus upon a particular thing for a longer time, and they are easily distracted. And before going into schooling, most of the time this attention span is not noticed. Okay, because there is no much cognitive activities involved, especially in schools. We have a lot of cognitive attention demands, so there it is easily noticed and identified and gone to the clinician, and the diagnosis is done. Okay, children having this attention deficit problem, they will be able to, they will exactly look like a normal children. They may be hyper sometime, and they will be running up and down, they will be doing lot many activities, there is no issue as such, but they will find always difficult to get involved, or get involved or finishing up a work which would rather demand more of cognitive side. They are not able to sit in one place, they always fight with other children, and the reasons may be many. And they will not be able to sit idle in a place, even if they are watching their favorite cartoons. They will be looking at it, and easily they are distracted from sounds from other side, and at the same time they will be sitting on a couch, or to whatever level, in the extent it is comfortable, they will be fidgeting their hands, shaking their legs, and if somebody is there, just you're bothering others. So that kind of activity is always noticed in the children diagnosed with ADHD. Okay, and mostly, as I said, it is diagnosed when the children go to schools. Okay, there the cognitive demands is high, so there the teacher notices that this particular boy or a girl, they are not able to attend to the classes, they are not able to sustain their attention in a particular activity. There it is noticed. Usually this disorder is diagnosed in the first 5 years of life, not later, which means after 5 years. So in the first years of life, the symptoms are usually very explicit, and that's the time we enroll the children to schools. There it is usually noticed. And if what if a child is showing the symptoms of ADHD, that hyperactivity and the less attention span, just after 5 years, not before that. Before up to 5 years, the child was perfectly normal, there was no hyperactivity, no attention deficit, he was able to focus and sustain his attention, and after 5 years it is noticed. So in that case, the further careful evaluation must be made, whether it is something, some impairment has happened to the brain later, maybe some due to some head injury, or some after effects of fits, that seizure attacks. These things have to be carefully diagnosed. Okay, usually it is identified in the first 5 years of age, and I said it is mostly found in the boys in comparison to girls. I don't know why boys are at risk. This is actually an inborn disorder, and most of the cases, when the child reaches somewhere around 13 to 14 years, though most of the symptoms go down, subsides, and many cases, or some cases I can say, okay, not many cases, some cases it continues into adult life. There it is diagnosed as adult ADHD, and they may have a lot of problems. And children diagnosed with ADHD, they will be very impulsive in nature. And when I talk about impulse, I have already done a video on impulse and what are the things that we should do to reduce the impulsivity in our children. I have a video in the channel, so if you are not watched it, you can just go and watch it, and that will be informative, that may be helpful for you. Children diagnosed with ADHD, they will have always trouble in standing in queue. They never complete any particular activity. They easily get involved with work and activities, and they do it half and jump into the other action. Their actions are their behavior is not goal oriented, it's all impulse. They jump into conclusions very easily. They don't listen every bit of what others say. They just pick up from here and there, because their attention is not sustained, and because of their the reason they are not able to finish up their work, they always have trouble with doing their homework, doing their assignments, and all these kind of things. So because they are easily distracted, and impulsiveness, as I said, is very high in this particular disorder. Later they may get into some criminal cases. Children diagnosed with ADHD, they also face a problem, like getting along with others, because you can just imagine if a few children come together and they make a game and they are playing, and every game has got their own rules and regulations, how to do, how not to do, and that is the beauty of every game. And these children, they are not able to follow rules, because they jump, they don't walk, they jump actually. So since they are not able to follow the rules, they always makes mistakes in games, and once everybody not point it out, they don't like it, and they get into conflict with others. And if it frequently happening, what other children will do? Normally they will side the child. Okay, we don't want you to play with us. Okay, or they will change the place to avoid him, and later this boy will or girl will feel that I am rejected. And what later happen is that they may not be taking it in the right sense. They would say that nobody likes me, and nobody wants me, I am not cared, and I am left alone. This kind of feelings they may develop later, and that will result in a low self-esteem. And they generally never think that, okay, because of my problem, my colleagues, my classmates, so they avoided me, they don't take me into their games. Okay, that is a major issue later they face. This group of children, they mostly come from school with a lot of complaints from teachers. Okay, the most of the complaints will be like your child is not attentive, and he becomes a nuisance in the class. Teacher is not able to finish up their class because these boys, maybe all of the sudden he will stand up, and or he will disturb the neighboring students sitting left and right, or front and back, and that the teacher finds it very difficult. And a person with ADHD, they will be more talkative also at times, because of their hyperactivity and lot of ideas, flashing like, and they keep on talking, blabbering. So that will become a disturbance for other children in the class, and even the friends will find it very difficult to handle. The etiology of this disorder, that means the causative factors, we could say that, so we can divide into two, like one is biological and the second is environmental. What are the biological factors? One is genetically it is said some around 10 to 35 percentage of chance is there for a child to be diagnosed with ADHD if their immediate family members having the same issue, and there is a 50 to 57 percentage of chance is there if the child getting diagnosed with ADHD if the father or mother having ADHD or have been diagnosed ADHD in the past. Then second is neurochemical factor and neurobiological factor, the third one. And the other thing is that environmental factors, when we say, it can be birth related kind, if the child is premature birth and there may be lack of growth, so the child has got a higher chance of getting diagnosed with ADHD as they grow. And the other thing is that birth cry is very important, because at the time of birth, if there is a delay in getting the oxygen supply, because birth cry is very important for every psychiatric or neurological history that we take. The birth cry is very important, because if the child is not crying soon after the birth, that would indicate there is a chance the child is not getting oxygen supply, the air tract is blocked, so that can damage brain cells. And this kind of children, they may tend to have develop this or show up these symptoms. I would say, from my clinical experience and whatever I have noticed in my life, all these children diagnosed with ADHD in the younger age, this, as I said, it goes through the school age, it goes to the 12 to 13 to 14 years of age, and most of the time the symptoms subside, and I said some cases it will continue to adult life. Whether it continues to adult life in the same full swing or not, all these children diagnosed, they will have some impulsiveness in their future life. In order to diagnose a child with ADHD, we needed 2-3 factors, very important, that we must take care of it, and every clinician is aware about it. The symptoms should be pervasive over situations. Pervasive over situations, in the sense the child should be having the same issue at home, okay, and he will be behaving same as in the school, and same in the clinic, same in the supermarket. Maybe first time when the child enters the clinic or comes to the class, there may be some disciplined type of behavior, but gradually as he becomes familiar with it, he will come to the symptoms will come in full swings, and everywhere he behaves the same. It is not that my child is hyper, he doesn't have the attention span sustained only in the school, but at home he is fine. No, it cannot be. If that's the case, I would say it is not ADHD. Okay. And another thing is that the persistence over time in the sense, if the child having the problem in the morning, afternoon he is fine, every day it is same, or today he has got this hyperactivity and all kind of issues, and tomorrow he is fine, and day after tomorrow is fine, and another day again starts. So we must be very careful. We have to recheck it whether it is actually ADHD or not. In the ADHD, it is pervasive over situations, and it's persistent over in almost every time. Learning disability is a condition that mostly found in children diagnosed with ADHD, and in the learning disability, reading disorder, dyslexia, that is very commonly found in children of this category. And if what is dyslexia, I will be making another video about dyslexia and other learning disabilities, and I will talk more about it. That, and children diagnosed with this particular issue, ADHD, they also have some conduct disorder. So conduct disorder and ADHD both are different, and what are the criteria when we can diagnose a child with a conduct disorder or contact disorder or ADHD. I will be doing another video about contact disorder. I will be talking more about that. And to diagnose ADHD, we have a different criteria. So this is what attention deficit hyperactivity disorder is. And the management part, I will be doing another video because that would take a longer time and would take lot many theories, and I will be doing it in another video. The psychological part and the medical part. Medical part, I will just say, just brush up, because I am not the authorized person to talk about medicines, because I am not a psychiatrist. I am a clinical psychologist, and a psychiatrist will be able to talk more about medicines. And there is always updation on in the medical field as well as in clinical psychology, and there are new medicines coming up and lot many researches happening, and we will be doing the management part in another video. So thank you very much for watching this video, and stay tuned if you like this kind of videos to know about a lot many psychiatric issues and human psychology and animal psychology. And I will come up with more and more interesting topics that is very useful for everybody of us, and in our lives, in our lives of children and family. So thank you very much. We'll see in another video. Bye bye.